Okay. Oh, that way. Okay. So the situation in Australia is that it is illegal to vape with nicotine unless you have a prescription. So most people don't, and they're committing an offence. And you can be jailed for up to 2 years in some states of Australia and fined up to $45,000 for possessing nicotine. Now that hasn't been enforced, but that's hanging over people. And vaping products are regulated as tobacco products, so they have the same kinds of restrictions. Nevertheless, there are 240,000 vapers in Australia. So people are making the choice to save their lives and commit an offence, which makes sense. Heat not burn is illegal. You can import a small amount of snus, but it's taxed at a very high rate. So really the environment is very hostile. Now I think the basis of that is the government attitude. So our two peak health bodies, the National Health and Medical Research Council and our regulator, the Therapeutic Goods Administration, are both strongly opposed to vaping. And they take a precautionary approach. We don't have enough evidence. We just want to watch it for a while. People overseas are making mistakes. We're just going to make sure, watch what happens there, and then we'll learn from that. And all the state and federal government health departments are opposed to vaping, every one of them. But as well as that, all our health charities, the Cancer Council Australia, the Heart Foundation, the Lung Foundation, the Asthma Foundation, are all opposed, and all our medical associations, the College of Physicians, the AMA, the Thoracic Society, and so on. So amongst doctors, there's not much support. And that's why smokers who want a vape can't get a prescription from their doctor, because there's no official support for vaping, and the doctors are uncomfortable about doing that. So we have a problem with negative media stories and a lot of misinformation. So this is what we've decided to do about that. We've formed a registered charity called the Australian Tobacco Harm Reduction Association. And our role is to educate the public and health professionals about vaping. We have a board of directors, 3 of which are here today. You've heard Joe speak earlier, and Alex you'll hear at the end. And we take responsibility for managing the charity. We obviously receive no funding, and none of us have any conflicts of interest. But we have a broader role. It's about, we want to encourage complete cessation of smoking in Australia, but we also want to reach out to the media, to stakeholders, and to spread the word as far as we can in amongst these organisations and key stakeholders to influence the debate. We did receive some initial funding to help set us up, and we're grateful to KAC, and there are 2 industry supporters in Australia who helped us to set up the organisation, but now we're relying on independent, unrestricted, tax-deductible donations, because we are a tax-deductible organisation. And we felt that was important for credibility. So if we have no links to industry or any other agenda, we'll have more credibility and we'll be taken seriously, and that's what's happening. We produced a website which we then took down and seriously rewrote, because the restrictions in Australia are just ridiculous. For example, we were told by our lawyers that any information about vaping is regarded as advertising. Promotion, it's called promotion if we talk about an unapproved therapeutic product like snus. That's promotion, and that's not allowed. You can't promote prescription products like an e-cigarette for quitting. That's talking about that's promoting it. It's illegal to promote or talk about heat not burn. You're not allowed to give medical advice, and how is that interpreted? You can't mention any brands or products, which is an issue for sponsors. So anyway, we've rewritten the website. This is a first draft, the latest draft of our website. So basically, we've got what is ATHRA, the description of it, and then we talk about smoking and health, how to quit, what is tobacco harm reduction, and what is vaping. We wanted originally to focus just on vaping, but we were told that we should actually broaden our focus and talk about how to quit and all the other things that people can do, and not just vaping. Again, that's a legal requirement. Oops, no, is that right? Wrong way. Okay. And then the second on the home page, you can see we've got a video from Public Health England, there's a video from Canada here on smoking. We have a blog, and we have a board of directors, a list of organisations that support tobacco harm reduction, and a list of Australian health professionals. So to add credibility to what we're doing. Just to show you the menu, basically to show you what we're covering. It's all about what we are, what our objectives are, who the directors are, and who our supporters are. So that's about us. And then we talk about smoking. So the problem of smoking in Australia, the health effects, and the benefits of quitting. And this is again to satisfy the legal people that we're not just focusing on vaping, we're taking a much broader perspective. And similarly, we give advice on how to quit. So there's a comprehensive quitting program there as well. So again, it's serving a purpose for people who want to quit in other ways as well. But if you can't, of course, then we go on to talk about tobacco harm reduction. And we do have sections on vaping, snus and heat not burn, but very carefully edited. And we have a section on, a sealed section for health professionals on vaping. So we can't talk about a lot to the public, but we can say a little bit more to health professionals legally. So we have a sealed section they have to sign in, and they can learn more useful things like how to write a nicotine prescription, for example. A lot of vapers tell us they go to their doctors for a script. One vaper said he'd been to 40 doctors and couldn't get a script. And some doctors have said we don't know how to do it, so we've included that information. We're giving them a counselling guide, what to say to patients who want to quit and so on. Accurate information about efficacy and safety, so they have the research that we're all aware of. We have a section, this is a section for health professionals. So basically, yes, it's all about vaping, the evidence, what is the law in each state, how to prescribe nicotine, and the counselling guide, and the whole range of resources. So that's our website, which is our core resource, but we also have other activities. So this is perhaps even more important, but we're building relationships with the media. We have a lot of very friendly media now who are arguing our case and countering the anti-vaping narrative. So that's been really important. We write op-eds, media releases, and we're running campaigns. We're visiting members of parliament and getting surprisingly good reception. Submissions, petitions, mail-outs to MPs. We speak at conferences, write articles in journals. We are liaising with the colleges and the associations, and we work with a number of other stakeholders. So we are having a reasonable reach. And just finally, to show you our latest campaign, or our first campaign, which was on World No Tobacco Day. So we thought we'd reach out to the public, and we produced a media release. And it was all about the issue of the stalling of smoking rates in Australia. And this is where Carl was saying Iceland's forgotten. They weren't forgotten by us, and they were at the top of the table. And what this shows is the annual rate of reduction in smoking rates in each country over the last 3 years. So each year in Iceland, they've reduced their smoking rate by 12%. Norway 7%, USA 7%, England 5%, Canada 4%, New Zealand 3%, Australia 0.2% reduction in smoking rates per year, which is not significant. We got good response to that, a couple of television spots, a whole lot of radio interviews, and a whole lot of printed media and online media. Starting with this article here in our biggest news website, news.com. Again, looking at the comparison and saying Australia's got the highest cost of smoking in the world, the highest price of cigarettes. We've got plain packaging, very strict tobacco control, but we're going nowhere. And the main difference is that we're not accepting tobacco harm reduction. Why is that? And these other countries which have tobacco harm reduction have much faster falling rates. So again, articles in different magazines, online, even in New Zealand. Thank you, New Zealand, who are supporting us all the way. On another news website in Australia. And yes, that's probably the last one. But we just feel we aren't going to break through with the medical practitioners. They're very resistant. The public health organisations are very locked into their entrenched views. The bureaucrats in government are totally opposed. Well, cancel. Sorry, cancel. Can you shut that up? The only option, we feel the way forward is to convince politicians and educate the public and get the public advocating for us. So, thank you.